Hi, Dr. Gullberg here, continuing our infectious disease lecture series. Today we're talking about sepsis syndrome, definition, septic shock, that type of thing. Let's review this. So first thing you got to know is what SIRS is, which is systemic inflammatory response syndrome, coined by Dr. Roger Bone, pulmonologist, intensivist, who's no longer with us. But basically, it's when two or more of the following criteria are met. Number one, body temperature less than 36 degrees centigrade or greater than 38 degrees centigrade. Number two, heart rate greater than 90. Number three, respiration rate greater than 30, or the PCO2 less than 32. And D, white count less than 4,000 or greater than 12,000 or a 10% band level. So, this SIRS is related to cytokine storming, and in order to have sepsis, you have to have SIRS with a suspected infection. There may be an elevation of the PCT, procalcitonin level, or CRP as well. Then we talk about MODS, which is multi-organ dysfunction syndrome. That's when there's problems with the liver, kidney dysfunction, coagulation problems, maybe a paralytic ileus, maybe a low platelet count, maybe a ARDS type picture, maybe a cardiomyopathy. Important to know what MODS is, separated from SIRS and sepsis. Once we have severe sepsis, we've got MODS for two or more organs with a lactic acid level or equal to greater than 2 millimoles per liter and less than 4 millimoles per liter, with a normal blood pressure after 20 to 30 milliliters per kilogram bolus. So severe sepsis is sepsis with more severity. Septic shock then is when the mean arterial pressure is less than 65 after fluid boluses of 30 milliliters per kilogram and a lactic acid level of greater than 4 or a base deficit of greater than -9. Procalcitonin levels are frequently very elevated here. Now, they've added a cryptic shock, which is sepsis with normal blood pressure but a lactic acid level of greater than 4. So that's not as common, but need to know about it. So septic shock occurs with capillary leak syndrome, low peripheral resistance rather than high peripheral resistance, and a lot of third spacing and hypoperfusion of organs. So septic shock is a deadly disease. We've improved the mortality a little with it, down to about 20 to 30% from 50 to 60% 30 years ago. But it's still a deadly disease caused by gram-negative rods more than gram-positive cocci. But you need to know about the definitions. SIRS, MODS, severe sepsis, septic shock, and cryptogenic shock. So hopefully this will help. Thanks, Dr. Gullberg signing off.